Eczema or dermatitis is an acute or chronic inflammatory reaction in the skin, often due to an external, is it exogenous or internal, which is endogenous factor. So exogenous eczema or contact eczema includes primary irritant dermatitis and allergic contact dermatitis. Endogenous eczema includes atopic eczema, seborrheic eczema, discoid eczema, steatotic eczema, varicose eczema, and endogenous hand and soles dermatitis. So, contact dermatitis may be an irritant as concentration dependent or allergic as delayed hypersensitivity reaction to specific external substance such as metals, rubber, chemicals, among others. In contrast to the endogenous types, the skin reaction is confined to the areas directly in contact with the offending substance or allergen. Atopic eczema is a common chronic but self-limiting pruritic skin disorder, mainly of childhood, but sometimes persists into adult life. And the rash usually appears within the first year of life, mostly between ages 2 and 4 months. In older children, the rash characteristically involves the flexural areas. The family background of atopy, asthma, hay fever, eosinophilia, allergic rhinitis, and similar skin problems is often present, and the condition is characterized by relapses and remissions. Seborrheic eczema presents as a scaly, flaking, dry, and reddened rash of the scalp, eyebrows, nasolabial folds, perioral, periorbital, and periauricular skins. And sometimes it presents as hypopigmented macules. It may be associated with Pityrosporum ovale infection. Extensive forms are associated with immunosuppressive states, particularly HIV/AIDS and diabetes mellitus. So the main causes are genetic, irritants like acids, alkalis, detergents, petroleum products, and also allergens like nickel, rubber, additives, chromates, hair dyes, topical medications, plants, nail varnish, cosmetics, and other topical medicaments, and fungal infections, for example, Pityrosporum ovale and dermatophytosis, and venous stasis in varicose veins, heart failure, and lymphedema. So the main symptoms are itchy skin, dry skin, weeping, reddened rash, relapses, and remissions pattern. The signs that are usually elicited are dry skin, scaly skin, erythema, excoriations, and also papules, vesicles, fissuring, post-inflammatory hyperpigmentation or hypopigmentation, and lichenification. Investigations are patch testing for contact dermatitis, skin scraping for fungal elements, HIV screen, as in seborrheic eczema in adults, and fasting blood sugar, seborrheic eczema in adults. So the main treatment objectives are to relieve or control symptoms and to identify and avoid any causative or predisposing factors. Non-pharmacological treatments, counseling of the patient, and also avoidance of identifiable precipitating factors. Pharmacological treatment for topical eczema, use If 45 cream topical in adults, you apply 12 hourly. In children, you apply 12 hourly too. Or Acheus cream topical in adults and children, you apply 12 hourly. Or you can use shea butter topical in adults and children, you apply 12 hourly. Or salicylic acid ointment 2% topical in adults and children, you apply 12 hourly too. And also you can use oilatum soap or bath gel topical in adults and children 8 to 12 hourly. And also hydrocortisone cream or ointment 1 to 2.5% topical in adults, you apply 8 to 12 hourly, and in children 1% cream between 3 months to 12 years, you apply thinly 12 to 24 hourly in the area of rash. Or you can use mometazone lotion or ointment 0.1% in adults and children, you apply thinly once daily. Or you can use betamethasone cream or ointment 0.05 to 0.1% topical in adults, you apply thinly 12 to 24 hours. In children, use 0.05%. 1 to 18 years, you apply thinly 12 to 24 hours. And also chlorpheniramine, you can give chlorpheniramine oral in adults 4 milligrams 4 to 6 hourly, or 4 milligrams once at night for 7 days. In children 6 to 12 years, we give 2 milligrams 4 to 6 hourly, or 2 milligrams once at night for 7 days. And 2 to 6 years, 1 milligram 4 to 6 hourly, or 1 milligram once at night for 7 days. And also 1 to 2 years, 1 milligram 12 hourly, or 1 milligram once at night for 7 days. For seborrheic eczema, use miconazole 2% plus hydrocortisone 1% cream topical in adults, you apply 12 hourly till rash resolves, and in children too, you apply 12 hourly till rash resolves. Or you can use clotrimazole 1% plus hydrocortisone 1% cream topical in adults, and in children, you apply 12 hourly till rash resolves. And also you could use ketoconazole shampoo topical in adults, you apply twice weekly for 4 weeks with at least 3 days between each application. In children 12 to 18 years, use a shampoo, you apply twice weekly for 4 weeks with at least 3 days between each application. Less than 12 years, the safety and efficacy is not established, so it's not usually recommended. Or you can use selenium sulfide shampoo in adults, you apply whole body 2 times per week for 2 weeks initially, and then once every 1 to 2 weeks to control symptoms, and allowed to remain on the scalp for 2 to 3 minutes, and then rinse thoroughly. For children 5 to 18 years, same as adult dose. Less than 5 years is not recommended. Or you can use itraconazole oral. You can give 100 milligrams daily for 3 weeks. More than 12 years in children, you give 100 milligrams daily for 3 weeks to 1 month to 12 years, 3 to 5 milligrams per kilogram daily for 3 weeks. The use of itraconazole is associated with potentially life-threatening liver toxicity, so monitor the liver function while on long-term therapy. For contact dermatitis, betamethasone cream or ointment topical. In adults, you apply thinly 12 to 24 hourly for 7 days. That's a 0.05 to 0.1%. But in children, use a 0.05%. From 1 to 18 years, you apply thinly 12 to 24 hourly for 7 days. Or you can use mometazone lotion or ointment 0.1%. In adults, you apply thinly once daily for 7 days, and in children too. For facial contact eczema, you use hydrocortisone cream 1% topical. In adults and children, you apply 12 hourly. Referral criteria: so refer patients not responding to treatment and those needing further investigations, such as patch testing, to a dermatologist.